Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. It's Wednesday. We've got Dr. Phil Chan. We're going to be talking about some of the biggest healthcare issues. Dr. Chan, thanks so much for joining us.
Thank you for having me.
Dr. Chan, Monday morning I had my annual physical. I went to see my primary care physician, and I like him very much. Great doctor. And the nurse came in and said, "You haven't had a tetanus shot in 10 years. I said, "I don't think I've had a tetanus shot in 40 years, maybe longer. I don't know the last time. Maybe like when I was like 6 years old, I had a tetanus shot. I have no idea." And she gave me a tetanus shot, and it didn't react particularly well to it. Didn't sleep well that night. Had no expectation of that tetanus shot, whether I'd feel good or not feel good. I did not pass away from the tetanus shot. We've kind of gone from having a level of trust with our primary care physician on a basic things like a tetanus shot, which seems to be rudimentary medicine, to an environment in which people are very fearful, resentful about things as simple as vaccinations. Your thoughts?
I think vaccines are one of the biggest scientific and medical advancements of this century. A lot of these infectious diseases that we have vaccines for were killing or causing significant sickness and disease for people in the last, couple, 100 years. Vaccines are really a marvel of American science. That being said, it is a decision that needs to be made by a person in conjunction with their primary care physician or other provider. And I think what worries me the most, Josh, to your point, is just the spread of misinformation, these conspiracy theorists. I'm okay if people decide to not get a vaccine, but it really should be based on science and evidence and in conjunction with a discussion with a primary care doctor or another trusted healthcare professional.
Do we run the problem of, and I'll say it because I think it's my experience, as smart as you brainiacs are, right? Like, no one wants me doing heart surgery. No one wants me messing around doing any kind of health care. But as smart as you all are, you're not the best communicators. It's not really in your proverbial DNA. And so, she comes in and gives me a shot. She really didn't tell me I was going to feel like crap and not sleep that night. Is that part of the problem, which is we just don't do a good enough job in education? And I'll get to the other issues in a minute. But is that one problem?
It is certainly part of it. I think myself as a physician, we don't always do the best job communicating to patients about potential side effects, about potential other considerations. And part of that is, certainly on us. Part of it's also the system where we're expected to see patients in 15 to 20 minutes a lot of times and talk about everything, including vaccines and diabetes and blood pressure and diet and exercise and do you wear your seatbelts or bike helmets. It's really impossible to do. And I think for a lot of us, sometimes we shortchange our patients because of that.
Let's jump over to sort of the national issues. Robert F. Kennedy Jr. I even cringe saying his name. This week fired all the members of the CDC's Vaccination Advisory Board. These are serious people, leading experts across the country. His rationale is not very clear. What's the impact of this?
So this is a big, big deal. So the ACIP, the Advisory Committee on Immunization Practices, was an independent scientific and medical committee that determined recommendations objectively about who should get vaccinated here in the United States of America. And it's been followed as guidance by lots of other countries as well. These were 17 experts, really cream of the crop. In fact, we have one person here in Rhode Island, one of my colleagues, Sybil Sienis, who was on it, a very good, trusted doctor. But the firing of these people is really going to hamstring us here in this country in terms of understanding what to do.
Why couldn't these 17 or some other collection of them set up under the Rockefeller Foundation or set up under some other foundation structure and do the same type of work to be able to give people that information? Like, Listen, we're not going to win an argument with Robert F. Kennedy Jr. It's not going to happen. All the things he said he wouldn't do during the confirmation hearing, he is now doing. So I don't think there's any battles to be won there. You just got to wait out the period of time in which he's Health and Human Service Director. Why can't those 17 set up shop somewhere else and provide that information?
And that is largely to the extent it's what's going to happen. Our CDC does not have a director. Uh, there's been someone that's been nominated but not confirmed yet. Without the ACIP, there really is no one at the national level who's making evidence-based decisions about who should get vaccines or not. It's really coming down to RFK Jr., who does not have expertise in this area. So what's going to probably happen moving forward is that some of the national academies, some of the national organizations of experts, the American Academy of Pediatrics, there's the Infectious Disease Society of America, some of these academies that are populated by infectious diseases experts, by vaccine experts, are probably going to be the ones to come out with some more of these formal recommendations that many of us physicians will follow.
And is that emotion now? I mean, listen, if I came to the conclusion, others must have, correct?
Yes. Yep.
Okay, let's go over to where we are right now. There seems to be this sort of dueling world on almost every political issue. I don't think vaccines are split 50-50. I do think, though, it's probably 15-20% of the population that have raised questions about vaccines. Certainly COVID is a red hot issue, but across the rest of the spectrum of vaccines, over the course of your life, you're going to get about 30 different shots, correct?
It's going to be probably more like 15 to 20. Yes, there are a bunch of them. A lot of them are given in childhood, and some as you get older too. And those are the two groups that tend to be most susceptible to infectious diseases, the very young and the very old.
And there's been some change of protocols, as in the case of like the pneumococcal pneumonia vaccine, which is a very serious when people get over 60. The most high-profile person who died of pneumococcal was Jim Henson of the Puppets. That's now moved up. I think it was 65 or 70 years old. It's now to 60 years old. But that education used to take place via the federal government with grants down to the states. There'd be public education campaigns. That whole system needs to be reworked now, correct?
So, the approval of vaccines is a long and complicated process. It really starts with basic science. It starts with these clinical studies done by researchers and scientists and doctors. And then it goes to the FDA, the CDC, the ACIP, which is often historically who the CDC has listened to, et cetera. So it takes years and years and years of study, both with safety as well as efficacy, effectiveness, in order to get these things approved.
And in that process, has the process made mistakes?
The process is pretty good. Has it made mistakes? It depends how you define mistakes. So I think the biggest concern is about unknown or side effects, right, or adverse events. There's multiple processes that are set up to catch those. So at the time of approval, there's going to be a lot of studies that have been done. I think the COVID vaccines, the Johnson & Johnson is the classic one. The studies did not pick up the signal of some rare events related to clotting. However, after the vaccine was approved, they do these post-marketing studies with close observation and follow-up, and they found a very rare signal of these clotting disorders that occurred, and the vaccine was eventually not approved and pulled from market. And that, to me, is a success and a sign that the process is working. Again, this has happened for other vaccines as well. A lot of these major complications are very, very, very rare for these vaccines. The vaccines that are approved, and certainly the vaccines that have been out for a while, are very safe and effective.
So where I get cynical as an individual, I'm reading the book The Empire of Pain, which recounts, written by a New Yorker writer, about the Sackler family and their climb to great wealth and power, was some shall we say, conflicts in the process between approval at the FDA and the Sacklers. Is there enough safeguards between the firewall between researchers and physicians and the pharmaceutical industry and correspondingly the government, almost a triad of firewalls?
It's a great question, and one that I firmly believe in. I think the key to this is transparency, and this is why committees, organizations like the ACIP are so important. Is because they are vetted, they are screened for conflicts of interest, for funding from pharmaceutical companies. You really want people, right, that make these decisions to not have a financial conflict with industry, with pharmaceutical companies. It's a fair point to say that we should not be getting medical advice from industry or pharmaceutical companies. We really need to be getting it from objective people who are not paid by pharmaceutical to make these decisions. And that's one of the reasons that's so concerning about the ACIP being dissolved, is who are going to be making these decisions.
Your recommendation, last word, if I'm that mom or dad and I'm seeing this information coming across different news organizations, different social media posts, what's the answer to my questions about the safety of different vaccines?
I would really, really encourage people to talk to a trusted healthcare provider and really their primary care physician or another provider. There is so much misinformation out there. You can't trust social media. To your point and what we just talked about, a lot of folks are making money off the spread of misinformation. People need to think critically about this and really need to go to a doctor or another expert about this. It's sort of the same way, like you wouldn't trust me to fix your toilet or your sink, right? After watching a YouTube video, people aren't going to be an expert about everything vaccine related after watching a YouTube video or another social media post.
Dr. Phil Chan, we always appreciate your insights, important issues facing Rhode Islanders. For everybody else, stay tuned. We've got a lot going on today. We've got Martin Chase on, and then we've got questions that we're posing to the president of Rhode Island Energy. Martin Chase will be on at 11. The president of Rhode Island Energy will be on at 12 noon. Also, there's a big story this morning, not just that the House passed a budget in the state legislature, but also some documents that we got a hold of through an access to public records request in the town of Portsmouth related to the tragedy in which a young woman was killed and 3 others were severely injured on the breakaway of the staircase from that facility social club down there in Portsmouth on Saturday. Stay tuned for much more. We've got it coming. Thanks, everybody.